So, where are we?
Well, we're at Overlake Hospital in Bellevue, Washington, which is a community hospital, not-for-profit, serving the whole east side.
And who are you?
I'm Bill Crounse. I'm the Global Healthcare Industry Manager for Microsoft.
And you're a Microsoft employee?
I'm a Microsoft employee in a tie, I know.
I thought we aren't allowed to wear ties. I thought that was part of that.
But I'm also a doctor, you see. So.
And who are we with? Because there's a whole bunch of people around here.
Okay. Well, basically, we've got, over here, we've got Kent Hargrave, the other guy in the suit, you see.
Yeah.
Just to confirm, this is the hospital environment. Kent Hargrave is the CIO here at Overlake Hospital Medical Center.
Yeah.
And actually, prior to coming to Microsoft, I was the Vice President and CIO and also Chief Medical Information Officer here at Overlake, which is why this is kind of home turf for me.
Excellent.
Yeah.
And what are we doing today?
Well, we're going to be taking a look at how doctors and nurses are using tablet PCs and healthcare information technology in general in the healthcare environment.
Wow, cool.
Yeah.
So what's next?
Well, what's next? I don't know. I think we ought to talk to Kent and find out, because he's the guy in charge here.
All right. Well,
Kent?
Good morning.
So Kent, how are you doing? Welcome to Channel 9.
Thank you.
So what are we going to see today? And
Well, if we're here to look at tablet PCs, we're using tablets by the physicians to come in and look up the medical records. They can review.
Here, let me turn around because the lighting really is pretty dreadful there.
Is this better?
A little bit, yeah. See, we're not professional here, so we don't. We got to rely on the ambient lighting here. Yeah, there you. Much better.
We can find lights. We have a number of mobile devices here.
Yeah.
So we've got computers on wheels. We've got what are called planar devices, which are kind of built-in laptops to mobile devices. We also have some tablet PCs as well as some notebooks. And so the doctors and nurses grab whichever device works best for them. Some of them like the tablets. They'll bring them right in, pull up the radiology images and show the patients. They can pull up the medical records.
Yeah.
So we have a number of devices that they can use. And so we're going to take a look at
now,
what some do.
My wife was just here about 2 months ago for surgery. And I loved it. There was Wi-Fi almost everywhere I went.
About 95% of the hospital is covered with Wi-Fi. We've opened up a public channel for patients and families, and it's free. And so anywhere in the hospital, waiting rooms, patient rooms, you can get free internet access.
Now this is probably where most Microsoft employees come too, right?
There's probably a number of Microsoft employees that come here.
Yeah, I met quite a few in the waiting room here. It's only about 20 minutes from Microsoft's main campus to here.
Including some very well-known ones who actually had their babies here. So this is the hospital of Microsoft.
Probably Bill, because
Probably, yeah. Although we don't talk about that.
Well, we just did. We'll see if PR edits that one out.
But no Overlake employee talked about that.
Yeah, okay.
That was a Microsoft employee who talks about that.
But on your foundation board, there's a board in the entrance which shows all the donations that are made, or the big donators.
Right.
And there's a number of Microsoft employees on that board.
There are Microsoft employees that donate.
In fact, actually, Robert, during my era here, when I was here, the CIO here, it was because of some Microsoft folks that actually we had a little bit of seed money to invest in technology that ordinarily we couldn't have done out of the normal hospital operating budget, and it actually allowed us to do some really creative and unusual things.
Very cool. So, how long have you worked here at Overlake?
2 years.
2 years. And how long have you been in the medical
Probably
world?
10.
10. And how has the medical world really changed over the last 10 years because of IT, because of computers and stuff?
The conversion of paper to electronic medical record has been a major change. Digital imaging for radiology has been huge. Being able to get those images from film to digital to the doctor in much quicker time. Like I said, the doctors can bring in their tablet PCs here and show the patient the film without having to drag them to a light box and show them what's going on. So it really has made a big difference.
Wow. So what are we doing today? Where are we going?
Well, I think in a few minutes, Dr. Steve Marshall, who's actually the emergency room director here, will be coming in.
Okay.
We'll be chatting with him. And then one of the nurses here in the ER will be showing us how they're doing their work on computers and tablet PCs and so forth. And I'll talk a little bit about why the tablet PC in particular is, I think, uniquely perfect for healthcare professionals.
Very cool. All right, so let's shut off for a second, and we'll be right back. So this system's on a cart, and you say some of the doctors have tablet PCs that they're using?
We have 2 tablet PCs currently. There's 20 providers here, and they use laptops and tablets. We've purchased 5 more tablets for them because they are finding that they like that more.
Yeah.
They do. They don't do a whole lot of keyboarding in front of the patient, and so they like the tablet to be able to show them. The physicians use voice recognition to do all their transcription.
Right.
So they go back to a pretty powerful desktop computer, do their voice transcription in the computer, have it translated using Dragon.
Ah.
Then they self-edit and it's done. So all of their charting is done real time.
Wow.
Nurses same way at the bedside. They type, but it's done real time. Versus having to do a 24-hour turnaround or a 4-hour stat
Yeah.
to take that long to dictate.
Yeah.
Now it's there real time and the patient's done. The chart's done. When the patient's transferred up to a floor, all the documentation is there,
Yeah.
ready to go for them.
Now, when my wife was here, I noticed that there was still a lot of the hospital that's not digitized and
Correct.
certainly not talking to a central computer. How long is it going to be before all the devices in the hospital talk to each other and where everything is digital or everything's on a computer?
We're probably talking 18 to 24 months.
Wow.
The ER was the first place that we started to really do entire paperless automated chart. In Fran's right, we turned it on in January and we turned the whole thing on. We did it in 4 months instead of 6, which is what most hospitals do. The nurses were great. Our unit secretaries were great. And so from the time the patient walks into the ER until they're discharged, no paper floats around here, which is really pretty cool. We're going to do physician order entry this summer, so the doctors will be using tablets and laptops to actually order their meds online. And then at the end of about the next 12 months, we'll be doing medication administration using barcodes on the patient and the meds to make sure that that's keyed up. And then right after that, we're going to be doing nursing documentation on the floors.
Okay.
At that point, we'll be pretty tight in and automated throughout the house.
Now, what kind of efficiencies will that give you? You hope. You know? Certainly, I would assume it's going to reduce some mistakes. You know, because doctors' handwriting it's really hard to read. You know, if I'd go into the pharmacy here with my prescriptions were I couldn't read them. I have no idea how the pharmacists get me the right stuff.
Probably because it's the same 40 or 50 physicians writing those orders.
Okay.
And so the pharmacists probably begin to recognize that writing. They know who to call if they can't really see it.
Yeah.
The pharmacist is the safety net at this point for those orders to really take a look at allergy checking. Is this going to interact with another drug that maybe another physician's ordered to make sure that that's there? Efficiencies, you're not looking for a chart. As Fran said here in the ER, anytime that you can get to a computer, you can see the chart. So same thing on the floor. There's a lot of time wasted looking for a chart. The other thing we've implemented here, and I don't see it here because we're probably early, is the Vocera badges. And that's a wireless voice over IP communicator, very much like the Star Trek communicator.
Yeah.
You push a button, you talk.
Oh wow.
So you push the button, you say, call Fran, and we're talking to each other on a VoIP phone. And so you no longer have to go find a landline. Our nurses, doctors, we've got our pathologists on it, as well as all of the radiology department.
Yeah.
And so when it comes time for communication, you're not looking for a phone. Again, big savings in time.
Wow.
So not looking for paper, not looking for people. And those are where the efficiencies come in.
Yeah.
For the patient, it's much safer because you do have all the information in one place.
Now, is this? Tell me a little bit about the hospital. Is this a regional hospital, or just for this region, or is it for multi-states? I know one of the hospitals here in Seattle actually has trauma patients flying in from Alaska and from.
Harborview is the main trauma center.
Okay.
Here for Puget Sound in the Northwest. We're a non-profit regional hospital, freestanding. We're not tax subsidized. We live on what we make here.
Yeah.
And we are a single site hospital. We do not own very many physician practices. We have about 3 physician practices that we own. If you take a look at like a Virginia Mason, they've got 350 owned physicians or employed physicians. Group Health does the insurance plan as well as employed physicians. So we kind of are what we are right here by ourselves.
Right. And are you seeing IT technology used to collaborate with doctors around the world at all, or any of that fun stuff?
Right.
I know that some of the teaching hospitals are doing more of that probably.
Some of the teaching hospitals are. We're working with the I-90 corridor
Okay.
East of here to try and get some telemedicine in to help those rural areas to come back. We help support Snoqualmie. The same kind of deal is they're kind of out there without the physician support, and so we kind of do that outreach. Working with a company right now to create a regional health information organization called RIO, which is a real hot topic in healthcare. And that's working with our community physicians to share data back and forth as opposed to carrying your chart.
Yeah.
It's now electronically transferred, or that's our goal, is to have it electronically transferred. Working with Evergreen and Virginia Mason to do that same thing.
Right.
Because we share a lot of patients throughout the region. And so we need to be able to tie that information back and forth.
Right. How the HIPAA regulations, right?
HIPAA.
Yeah. How does that change your job, and what kinds of things do you have to think about that you might not have had to think about? What are those regulations for people who
The
don't?
Health Information Portability and Accountability Act passed in 1996 to allow you as an employee, when you transfer from one company to another, to not have your insurance canceled. That was the original goal, which is great. You leave Microsoft and go to someplace else, and the
I
new
never
insurance.
do that.
I know. But the new insurer says, "Oh, you've got a pre-existing condition. We're not going to insure you," or you got a 3-month waiting period. HIPAA eliminated that, and so you're covered if you're covered before, you're covered later. Then they added in the security and privacy stuff. As healthcare providers, I think we've always protected patient information.
Right.
Nurses, doctors, employees know that we're not supposed to talk about, whose babies were born here, who we saw in the ER. That's always been a part of healthcare, is we don't share that information. HIPAA just made it formal.
Yeah.
We had some training. I don't think it was a huge learning curve because people already knew that they weren't supposed to do that. On the security side, for passwords and securing data, it required us to put in writing a lot of what we'd already done. We'd already required passwords. We'd already required, you to sign confidentiality statements that's saying, I'm not going to share my password, I'm not going to share the data. And I'm not sure all healthcare institutions were formal in doing that. They all did it. So HIPAA required us to become formal. Okay. So we've got policy and procedures saying, we're going to do backups, we're going to have disaster recovery, we're going to have passwords. We already had those, and most institutions did. So it formalized what we were doing.
Yeah. I guess one of the fears is now that my information is on the computer, it's a lot easier to share, because when it's a piece of paper, you actually have to have access to the piece of paper, right? But now with a computer, from a patient's standpoint, we're scared that somebody's going to hack into your system and get to my data or something like that. Or it could be sold or whatnot.
There is that fear. It's more easily transportable as an electronic image, no doubt. There are instances where people have hacked into medical institutions or have found that data to be able to do that. And there's always that fine line between the security and the ease of getting to the data. And so when it was a paper chart, we would fax that chart and it would sit on a fax machine somewhere.
Yeah.
We're pretty sure it was the doctor's office, but is it? With the electronic data, when you access the data, I know who you were and when you accessed it. So I do have a better track record of who accessed the data. Right. The paper can sit on the counter for quite a while and let anyone meander through it. Okay. Our computers have auto log-offs and time screensavers, and here in the ER they use a number of the devices use fingerprints for auditing to get in. And so having your data available to the right people at the right time is that trade-off of having it on paper, locked up, or on paper sitting on a desk. Yeah. So it is a trade-off.
Are you using RFID at all?
We are beginning to do some RFID tracking, and we're actually going to be using 802.11b and G devices. We use Cisco Airspace access points for our wireless, and they've come out with a new software that will track any 11B or G device.
Interesting.
And that's actually what we're going to do. We're piloting the tracking system now with laptops and tablets and anything that's got a BG, and then we'll later put it on all of our medical equipment.
Okay. I was thinking more of drugs, and
drugs will be barcoding.
Yep.
RFID right now is still pretty expensive.
Okay.
Patient wristbands are about $3 in RFID, and we see about 220,000 patients a year.
Wow. So that's a pretty significant cost.
It's a pretty significant cost. Barcoding is printing it on the badge, which we've already done, on your wristband. We label probably 80% of the drugs today, and in 12 months we'll label 100% of our drugs. And so we'll be able to barcode you and the drug, check with our medication administration record, and be able to say, yes, this is you, yes, this is your drug, and then administer it.
Right. Why are medical costs going up so much? That seems to be a big problem for companies. And how is this new technology going to maybe start to address that? That's a hard question, I know.
That's a trick question.
That's a trick question.
So the easy answer is that we're able to keep sick people alive longer.
Yeah.
I mean the reality is that when you have a disease, we can keep you alive much longer than we could before.
Interesting.
We have drugs today that can treat diseases that weren't treated 10 years ago, and those drugs aren't cheap. There are some new medical devices like drug-eluting stents for cardiac patients that they put in a drug-eluting stent as opposed to an open heart case. So that's much cheaper than an open heart surgery. The drugs that go along with that are pretty expensive. Medication errors, with our new systems, we reduce those. Every medication error can increase the length of stay by about a day,
Okay.
which is expensive to both patients and insurers.
Yeah.
So we're looking at everything we can to decrease those costs.
Yeah. I imagine it's a big part of your job is trying to figure that out, right?
It's a big part of my job trying to figure out the efficiencies for not just the staff and saving money, but our patients getting them in and out faster.
Yeah.
You don't want to be here. We don't really want you here.
Yeah.
We want you out healthy, and so that's our goal.
Yeah. Some of the equipment you guys invest in is quite expensive too, and that wasn't around 20 or 30 years ago, right? I'm thinking of like a CAT scan even, right?
Well, CAT scans are, just all medical equipment's expensive.
Yeah.
We're looking at a new 64-slice CT CAT scan.
Okay.
Able to diagnose much better. The exciting part about that is they're also just came out of clinical trials and I believe approved to treat lung cancer with that 64-slice CT, so they can direct the impulses from the CT to the cancer and obliterate it without surgery.
Wow.
And the next one is breast and brain tumors as well with that same technology.
And how much is one of these things?
I'm not sure.
Okay.
I can get that to you, but I don't know.
Millions of dollars, I would assume.
It's 1.5.
1.5 somewhere in there.
So it's not cheap.
No.
But the ability of what it can do is so much better than what's out there, in the last 5 years.
Yeah. Well, thanks. So where are we going to next? Or since you're the CIO here, what's your job like? Tell us a little bit about that. We have a lot of people who would aspire to be a CIO of a hospital or of a...
a good portion of my job is, the political side of getting funding to move technology forward.
Okay.
The fun parts of my job are working with the departments to meet their needs for what they want to do.
Yeah.
We've got some really neat directors here who are looking 5-10 years out. What do we want to do? Where do we want to go? And so it's a whole lot of fun to do that. Our director of the ER, our medical director of the ER as well, wanting to do this IBEX thing. Yeah. They're the drivers behind this. We saved quite a bit of money by implementing this system. The physicians felt a lot of pain with the new system because they were expected to now dictate and correct their own dictation transcription. Yeah. They're charting themselves now online. It was a big learning curve.
Right.
But it's a big step ahead for the physician who's coming on during transition, for the nurses to know what's happening. So, part of my job, the fun part of my job, is bringing in the new technology and actually seeing how it's helping our patients and their employees.
I'd imagine you get a lot of sales calls from equipment manufacturers.
We get a lot of sales calls from equipment manufacturers with the one-off software folks saying, here's what we can do. And it is difficult sorting through what we should do, what we can do. I try and not do just what's cool and neat, because you can get caught up into that.
Yeah.
It's like, this is the coolest next thing, let's do it. What's the business reason for doing it? And so we always have to think of that. We're a hospital.
Yeah.
We're not. We're not here to install computers for fun. And so that's the trick. Is what's the right thing to do with the right dollars that we have.
Very cool. Well, thanks for spending some time with us today.
Thank you.
I appreciate it a lot.
Thanks.
So why don't I talk a little bit about why I think the tablet PCs are so cool?
Very cool.
I think that's important.
Oh, I think they're cool.
First of all, as Kent mentioned, I mean, one of the advantages to patients that come here to Overlake Hospital is having access to a wireless network. Yeah. So, I'm sitting here doing my Microsoft Mail while we've been talking.
I can print that. There's Outlook.
There's Outlook. But if we talk about doctors and why these devices are so important, these devices offer several advantages that I think that make them uniquely perfect for healthcare. Yeah. For example, back in the old days, I would grab a paper chart, from someplace.
Yeah.
I'd be standing in front of the room. I'd want to get into that paper chart, and I'd look at Mrs. Jones and her diseases, and I'd look at her husband and I'd walk in the room and say, "Hi, Mrs. Jones. How are the kids? How's the husband? So on and so forth." We can carry forth the same analogy with tablet PC. It goes with me, but this is all of my charts. This is my thousands of charts, basically, all in one place. So I can ask those questions. I walk through the door, see Mrs. Jones, do my work, walk to the next room, do my work. Tablet PCs, I think, offer several advantages for healthcare professionals. One is data input options. Kent mentioned the importance of voice, and indeed, tablet PCs are handling voice quite well now. We also have digital linking. That's real important for docs, because they're not going to just sit in front of the keyboard like the nurses sometimes do, okay? Yeah. Digital linking is going to be important. They like the radio buttons, the drop-down menus, all those kinds of things.
Well, the other advantage of the tablet is you can use it while walking around.
Exactly. Well, mobility. In fact, you hit on another point I was going to make, which is mobility. Mobility is extremely important in healthcare. I mean, you're always on the move. You're walking from room to room, you're going here, you're going there. Just being able to have this device. We also find that interacting with patients, these devices are perfect because basically, it's not as distracting. The patients are very accustomed to this chart-like device. So now I can talk to you and I can make a few notes to myself, or I can go outside in the hall and I can dictate into the machine. That's a real advantage. Yeah. Then information worker tools are real important in healthcare. And since I know your audience are primarily developers, I want them to think about how they can help physicians and medical professionals with more intuitive user interfaces. Right. So you combine the intuitive user interface, the mobility, the data input options, and the information worker tools. Then you've got the sweet spot for healthcare.
Yeah. Now, Microsoft's already released some SDKs that make building apps for the healthcare professionals easier.
That's right. And in fact, in one of your earlier broadcasts, you talked about trying to think of the word they used for the data fields, tags. It was trans something tags. I've forgotten the terminology.
I forgot too.
But what's important about the terminology, or what's important about the concept, is this idea that with digital inking, where we can enter information into a field that is expecting a drug name or a diagnosis or a state or an address, that we can improve.
Are they constrained fields? Or?
No.
Because they've demoed that on Channel 9 before, where they can constrain like the address. So if you type in Washington, it recognizes it.
Exactly. So we can carry that same concept into the healthcare field and say, if I write a drug name and it's going to expect a drug name, it can increase the handwriting recognition or voice recognition substantially. So that's a really cool way to design things and improve the data input options. Because the one thing that busy medical professionals can't stand is things that slow them down. In fact, that's one of the things that's actually held back the adoption of IT. People have always asked me, well, why now? What's the big deal about healthcare IT? Well, really, it's only been in the past couple of years that we've had ubiquitous wireless like they have here. It allows me to do my email and other things, right? Yeah. Lightweight, highly mobile devices, data input options, the digital inking, the voice, the radio buttons, and all of that. Battery lives that are now going out 3 and 4 hours. Some of the newer models, I've seen 10 and 12 hours actually with heavy-duty batteries. So all the pieces have kind of come together to create what I call this perfect storm in healthcare IT.
For the tablet, are there docking stations that the doctor can dock in?
There are. In the same way that I use this in my office, which is basically I plop it into a docking station and use it on my desktop. I actually have a little wireless Bluetooth keyboard that I use with this, which I love. So between the wireless keyboard, I've got my desktop machine, pull it out, take it on the go. I actually have found now when I travel, this can be the only machine I travel with. And as you know, there are new form factors coming out too from manufacturers that are lighter, smaller, thinner, extended battery lives, etc. Another thing that makes this really a nice machine, now this is a Motion 1400. One of the things I like about this from a healthcare perspective is, again, they've incorporated the fingerprint reader.
Yeah.
So basically now my sign-on, whether we're talking about my sign-on at Microsoft, my Fidelity account, my Schwab account, whatever, it's just this. And doctors love that because keeping track of all those passwords and logons is very difficult. So basically a single sign-on with some biometrics is great for healthcare.
Yeah.
So I credit the manufacturers. They're starting to put those kinds of inputs.
Now, in a hospital
devices.
environment, do you need ruggedized devices, or is a standard motion or
I think
fine?
it depends. I think that particularly in the private physician's office, let's say you're a busy dermatologist or family physician and you're on the move a lot, I think these machines that are not ruggedized are just fine. I think when you start getting into busy emergency rooms like this, that the manufacturers do need to think about more highly ruggedized machines, because these things, they do get dropped, they're going to get fluid spilled on them and so forth. They're going to be able to clean them and sterilize them and all of that. So
Yeah.
it's important, yeah.
Yeah. Well, I saw a Panasonic Toughbook that was running a pistachio factory, so I
Right.
could imagine that kind of ruggedized device would be
Right.
great here.
Right, right. And,
Cool.
and one of the nice things about the tablets is, I mean, physicians can choose between form factors, the pure slate models and the convertible models that have the keyboard. So chances are a busy healthcare professional is going to find a model that is just right for their needs.
Yeah.
Yeah.
Very cool.
Okay. So,
So,
I like
so,
it.
so we're back down here, and somebody new came in. So.
That's right. This is actually Dr. Steve Marshall. Dr. Marshall is the director of emergency services here at Overlake Hospital.
Wow.
And a friend and colleague. Thanks for joining us today. And
Thanks, Bill.
Let me get you in the light, because the lighting is awful here. There you go. Much better.
so, you want me to start over again?
No.
Okay.
It's,
No take
Channel 9,
twos. No take twos.
Channel 9 has no take twos. No editing. No.
No cut and paste. Okay.
So what do you do here?
I'm the medical director in the emergency department,
Okay.
practicing
And
emergency physician.
what's your average day like?
Well, right now I do about 25% clinical time or shifts with seeing patients. Work a lot of weekends because of that. And the other 75% is management, administrative kind of chores.
Okay. And how are you? Obviously, we're here to talk tech, right? Tech
Right.
in the ER. How has that changed over? How long have you worked here, first of all?
I've worked here since 1986.
Wow, a while. And I imagine you've seen a lot of changes in the way that the hospital operates.
When I first got here, we were writing instructions for patients by hand at time of discharge, writing prescriptions by hand. Very early in the 1990s, we started doing instructions by computer.
Okay.
And so we've been using computers to help patient education, help patient flow in the emergency department for a long time.
Wow. And how has the work changed? Do you like getting computerized?
It has its own challenges. I'm comfortable in the computer environment. I've got 20 partners, and there's a diversity of comfort with using computers and technology in that group. All of them love taking care of patients, and some of them are challenged by computing.
Yeah.
As a way to do that.
Since you're probably talking to a lot of developers, what could developers do, programmers do to make better systems for the emergency?
The whole key to us is to design software that competes with what we do now. What we do now, or what we used to do, is we would dictate charts to document our record. And doctors can talk very fast and be quite complete and have a very useful chart in a matter of 3 to 5 minutes. Software to document a medical record as an emergency medical or a electronic medical record. It's hard to compete with 3 minutes in documentation time at this point. It's getting closer, but it's harder than doctors who speak very fast.
In fact, I think that's one of the things that developers often don't realize when they're thinking about electronic medical records. They think, oh, we just create some forms and it'll be real easy. But there's so much in medicine which doesn't fit into neat little boxes. Basically, you tell me your story, I examine you. Sometimes even just getting your story down the way you told it to me requires, some basically open script, right?
Yeah.
And doctors in the past have just freely dictated that. Now that adds we're talking earlier about the high cost of medicine. Transcription costs in a hospital like this can be absolutely astronomical. I mean, hundreds of thousands of dollars a month sometimes. So the fact that Dr. Marshall's crew now is actually, dictating their notes and correcting their notes. I imagine you're seeing some substantial savings in transcription.
Well, the hospiel is.
The hospital is,
yes. I'm spending more time in the hospital, saving more money.
Right.
The good things that technology does is it reproduces things that we use all the time over and over again faster than I can do it. For instance, we're now doing prescription writing on the computer. And that prints out faster than I can write it and hand it to the nurse.
Yeah.
It's much more accurate and it's readable.
Yeah.
We have no more problems with physician handwriting other than who signed it.
Do you find as you come in, to work every day and see a new patient that's been in the system, that having access to their electronic record basically makes it easier to kind of get a feel for what's going on in that patient? I mean, not again with handwritten notes and trying to interpret one of your partner's handwriting.
Absolutely. We've been using some form of electronic record for a while, and with our latest update, if you will, we now have access to yesterday's visit, if they come back today. In fact, that happened to me as I worked Sunday, and had a patient who went home and had to come back, and I was able to review the nurse's notes without digging through a file folder to find them.
Right.
And that's very helpful.
Now, I know you guys are starting to use some tablet PCs. Can you tell me about, is this working for you, and what do you like and what don't you like?
Well, the nice thing about the tablet is you can take it in the room. It's not too heavy. It's not obtrusive with the patient, and I can do some bedside documentation while I'm talking to the patient. What I've done in the past is jot notes down on a chart or piece of paper, and then dictate them later.
Now, do you have a camera on your tablet PC at all?
Ours doesn't come with a camera. We're not quite ready to take pictures for patients because of the security issues related to that.
Okay.
We're at least not going to let doctors take pictures of patients. That's not.
I haven't seen a model yet that does include a camera. Although I have thought, like for dermatologists or family doctors in their private offices, that having a camera on the device would come in really handy.
Yeah.
Interesting rash and documenting the chart.
Yeah.
We're actually very close to beta testing a system where the on-call physician could interview the patient from home with a video camera in the room, both directions, so the patient can see the doctor can see the patient, and at least take some information, get to know the patient before they come in and take them up to the operating room.
You could talk to you about Office Communicator and some of the cool stuff that the group at Microsoft is doing around presence and Active Directory and video conferencing and so forth. We had some good stuff.
Yeah, that'd be interesting. Have a doctor on call on Office Communicator.
The on-call doctors are very interested in it because they have to respond to other people besides me, and they waste time with the traveling where they can't actually do some work.
One thing we haven't talked about is when the whole medical profession was on paper, it was probably hard to see patterns. And now that it's on the computer, a researcher could be going through all the data of all the patients and looking for interesting patterns or interesting...
Well, we're doing that right now. We've actually been doing it for a number of years, where we chop out the patient identifiers to maintain privacy, but we share data with public health, with the CDC, looking for those kind of patterns in infectious disease that would suggest either a bioterrorism type incident or epidemic outbreak.
Wow.
We've been doing that for quite a while.
Very cool.
And in fact, that's one of the strengths when we talk about National Health Information Network and Dr. Brailer and all the stuff going on in Washington, D.C. right now about getting all of our healthcare system electronic. That's actually one of the prime benefits, is that with this de-identified information that researchers and pharmaceutical companies and so forth can study diseases and hopefully innovate and come up with new treatments and drugs and so forth much more quickly.
Now, do you guys do research with mental health patients at all, or is you're mostly in emergency?
We're not really a research hospital. We do some cardiac type protocols here, but we don't do mental health research at this time.
So, I was over in Cambridge at our research, and they are developing a sense cam, which is a camera that a patient or anybody can wear around, and it takes pictures and sort of helps you remember the day. And they've found that with people with memory loss, it's really dramatically helped them out.
Yeah.
So,
actually, I mean, Intel's doing some real pioneering work, and actually we're doing some partnership with them on some of these things, how you help the elderly in the home, what kinds of devices can you put into the home to make it easier for people to cope and stay at home longer. As us aging baby boomers hit the healthcare market with our chronic diseases and long-term care needs, technology is going to play a big role in keeping us at home longer and away from the nursing home, hopefully.
well, very cool. Anything else you'd like us to know about what it's like?
Well, we made a dramatic change with how we do our technology about 6 months ago, where instead of just having computerized discharge instructions and a computerized tracking system. We now have a nurse electronic medical record, physician electronic medical record, prescription writer. We're shortly going to go to physician order entry on the computer where the physician does the work. That is really a safety initiative, preventing transcription errors. The doctor doesn't handwrite the order. They click on the computer what they want done. And so somebody doesn't have to try to interpret what they said. The physician makes the decisions. It likely will create some new mistakes, but we're going to get rid of some old mistakes and hopefully improve our throughput.
Very cool.
Just to get a flavor of what's going on, here's a little article from Healthcare IT News I just pulled up, just came on across my computer. Note some of what's going on here. House spending, bill funds, $75 million for healthcare information technology. That shows the government's commitment to what's going on. Here, consultants predict 30% growth rate for physician EMRs, so electronic medical records. You can see an explosion of growth over the next 7 to 10 years, particularly of physicians, probably all physicians, whether they're in the office, the hospital environment, using an electronic record.
Now, we got a demo of the machine behind you. Do you have a tablet PC, that version of this?
I use a motion tablet, like Bill's holding. What's interesting about the technology and the diverse staff we have is that everybody kind of finds a piece of equipment that they use. I'm very uncomfortable taking a computer in front of a patient and typing because I'm old school. Now, the younger docs that are email savvy and have been computing since they were 6, they're very comfortable rolling in the computer and doing their charting at the bedside. And I think the patients that are in the Gen X age and younger are also comfortable with that concept. I haven't quite got there yet. But we have a variety of choices, which is very nice. You can carry the motion in, you can come out and sit at a workstation, or you can use one of the rolling computers. And the hospital has been very supportive in giving people the options. No single computer will work for 150 people, which we have here in our emergency department.
Very cool. What are the other challenges of using technology that you'd like to see addressed? Is it battery life, weight, size?
Weight is always important when you're computing all day long with a portable. So the thinner, the lighter, the better. I like the size because it feels more like a piece of paper when you're working as opposed to trying to chart on a PDA. I would see a PDA as a possible way for order entry, where you're checking boxes for the test you want to order, like a chest X-ray or an EKG.
Right.
But in terms of documentation, that's the right size. It's certainly will get lighter over time. I think at times the wireless network is not quite as fast as wired network, and so it takes not very long to get faster than a computer in your thought process and have to wait for it.
That was because I was upstairs downloading a video. I'm sorry.
When you first hand somebody a computer, their thought process is slower than the computer, and very quickly they get to be waiting for it, even though it's very fast. They're waiting on every click. They're waiting for the next job.
And human beings are a little impatient, aren't they?
We're impatient, but human beings catch up even to very fast technology. I mean, I started out with a Mac Plus.
Well, the technology you were using here is a browser-based application, right? Is that true on your tablet as well?
Yes, it is. Our program is a web-based browser type.
If the architecture of the app could actually be changed to make it more responsive, so particularly in a low bit rate situation.
Well, I'll take your word for that. The good news about this is...
Believe me, I know. I've been doing a lot of research with the web-based.
Our application is very useful in that I can sign on from home, and I can do charting at home at the end of the day. I can also check labs and check culture results from home. I can actually look at X-rays from home now. And so the web-based product really helps that.
You can work 24/7 just like we do at Microsoft.
Well, a good example of that is our Outlook is both web and a smart client. And the smart client works even if you're not on wireless, but the web one only works if you have a nice broadband connection. So
I've had a little experience with that.
Yeah. So that's a trend. We're seeing developers do 2 apps, one for web and one for the smart client, which is much more responsive and actually can have a lot more smarts.
Well, you just need to make the wireless faster.
Yeah.
We've caught up. Our brains have caught up with the wireless, so the faster the better.
Yeah.
Yeah.
In fact, among developers and the CIOs of the hospital IT world, there's a lot of debate about thick client and thin client and what's best. And in the same way that I think we need lots of devices in healthcare, I think that depending on the workflow and depending on what you're doing, sometimes thin client is a better choice, sometimes thick client. So it really depends.
Yeah. Well, cool. Thanks for spending some time with us.
Yeah.
Thank you for your time. Sure.
Good to see you.
Good to see you, Bill.
Take care.
Hey.
No.
This is Buzz. Come out here. Come here. The shy CEO. Buzz, who are you?
I'm the CEO of a little company called ActiveWords.
And you were just asking. You were hanging out in the background here, and you were just asking.
I'm just curious after listening to these very bright guys talking about how they're using technology, if there's one or another group that uses it and adapts to it more than others.
Yeah.
A type of doc, a type of specialty.
Well, I think one of the things that really irritates me is we'll hear people say, oh, well, doctors are technophobic. They don't like computers, they don't know how to turn them on, et cetera. And nothing could be further from the truth. I mean, if you look at cell phones, for example, who were the first people on Earth using cell phones? Docs. Why? Because, first of all, it met a really important business need, and it was good for patient safety and quality. So if you take those same parameters and apply them to healthcare, if there's a return on investment, if there's a business purpose that improves safety and quality, docs will be the first to jump on board. The problem, alluding to what I said earlier about tablets and everything else, was that until fairly recently, the technology really hadn't kind of caught up to a point where it made sense in healthcare.
Yeah.
Now it has.
Yeah.
So,
I just look at how you're carrying it around underneath your arm. That was impossible.
It was
3 years
impossible.
ago.
It was impossible. Yeah, and the mobility, to be able to wander this hospital and have a connectivity, and the bandwidth, and all of that, and the data input options, and all the things I talked about, really are the pieces are coming together. So to Buzz's question, first of all, doctors will use this technology when there's a good reason to do so, when it increases productivity or quality or safety. The prices are starting to come down. I mean, electronic medical records today are way too expensive. For the small family physician or pediatrician, $10,000 a seat, way too much. We need solutions that are a couple $100s a month for hardware, software, and services. And the good news is I see the price point kind of inching towards that. And actually,
you said an interesting question there, or an interesting point. A month.
A month.
Are there becoming services like Salesforce.com has that kind of service model for?
There are. Again, some of the really creative vendors, particularly in the ambulatory EMR space, are coming up with those kinds of models, which are by the month. We're not at the $200 to $300, maybe the $500 to $600, but the price is dropping. And actually, there was an article not too long ago, I think it was in the Washington Post, where Microsoft and .NET were actually credited with helping to drive down the price point of these solutions, because the developers are able to take more of the sort of the commodity stuff that Microsoft does and more rapidly innovate and put commodity pieces in the solutions they're coming forward with in healthcare. So
now, what do you do at Microsoft? Okay. What's your job other than coming in here and having fun?
Yeah. I'm a global healthcare nursing manager. So basically, my job is about our vision and strategy, and to some degree evangelism for everything we do that touches clinicians worldwide. So I get to travel the world and through hospitals all over the place and watch what clinicians are doing, and work with our product groups and work with our business groups and figure out how we can make things better for docs and nurses and people working in healthcare.
Right. Do you ever see a day when Microsoft's going to do a version of Windows just for hospitals, or?
We get asked that a lot. We get asked. A lot of my colleagues in primary care are saying, why can't we just buy an EMR solution from Microsoft out of the box? I don't see that happening. We're very partner-centric, and we work with partners and basically take the broad commodity stuff and get it out there in the developer community so they can build great solutions and create businesses that sell to healthcare. I think we're getting a little impatient with some of the stuff that's out there. We'd like to see even, richer, better applications. And I know my physician and nurse colleagues would like to see things that work even better for their workflow and their needs. So we'll get there.
Yep. Well, cool. Well, thanks for
You bet.
taking us around.
Thanks, Robert.
Thank you.